Murder in the morning from the Hidden Killers podcast.
Well, the family of a severely diabetic man who authorities claim died due to mistreatment by a nurse overseeing his care has filed a wrongful suit against the facility where he resided. The suit alleges negligence and failure to prevent abuse that ultimately led to his death. I'm concerned about this one and how many other people have been affected by this individual.
There's been quite a few, actually.
Yeah. Nicholas Cymbol, 43, was a resident at Sunnyview Nursing and Rehabilitation Center in Butler County, Pennsylvania, where he required around-the-clock care to his medical conditions. He was a brittle diabetic, experiencing large swings in blood glucose levels, and also suffered from an anoxic brain injury, blindness, and neuropathy. The lawsuit filed by the family's attorney, Rob Peirce, accuses the facility and its operator of negligence, claiming they failed to train employees to recognize and report abuse. It also alleges that they neglected to remove the nurse responsible for the mistreatment, despite multiple red flags.
That's comforting.
And we're seeing more and more of this because I think there's a shortage. I know there's a shortage of people that are qualified to do these things. So it's unfortunately one of those things where, well, we need bodies, so we're going to keep them there. It's one thing to do that in a restaurant. It's another in a nursing facility.
Yeah.
The nurse in question, Heather Presty, faces charges for administering excessive doses of insulin to patients, resulting in the deaths of 17 individuals across 5 different care facilities. Cymbol's family contends that Presty bullied and abused him, contributing to his demise. According to the complaint, Presty routinely insulted and betrayed Cymbol, preventing him from receiving proper care and nourishment. She allegedly called him derogatory terms related to his brain injury in front of other staff members and singled him out during mealtimes. Presty's behavior, as described in the lawsuit, extended beyond verbal abuse. On one occasion, she reportedly told colleagues that Cymbol was going to be the next one to die anyway. Despite these alarming statements and actions, the facility failed to take decisive action to protect Cymbol and the other residents under her care. Good. I hope they go out of business. I hope this pulls them down, because if you can't get people like this under control, you shouldn't be in this business. The suit alleges that Presty's mistreatment of residents was not isolated to Cymbol, but was pervasive throughout the facility. It claims that multiple staff members noticed suspicious circumstances surrounding the deaths of residents she had to attend to, raising concerns about her involvement. On April 30th, 2023, Cymbol's condition took a severe turn when Presty administered an excessive dose of insulin, causing his blood sugar levels to plummet. Despite attempts to reverse the effects, she delayed calling for emergency assistance until confronted by other staff members. Cymbol was hospitalized for hypoglycemia, but was discharged and returned to Sunnyview the same day. Tragically, Cymbol's condition continued to deteriorate, and he was found in a hypoglycemic crisis early May 1st. Despite efforts to save him, he passed away shortly after, with the cause of death initially attributed to myocardial infarction. It wasn't until later that the true cause of Cymbol's death came to light. An investigation by the Pennsylvania Office of the Attorney General revealed that Presty had administered a lethal dose of insulin to criminal charges, leading to criminal charges against her. Presty's arrest and subsequent charges shed light on a pattern of alleged neglect and abuse that extended beyond Cymbol's case. She's faced multiple charges of attempted homicide and neglect of care-dependent persons in connection with deaths at various facilities across Pennsylvania. The family's lawsuit seeks unspecified compensatory and punitive damages, demanding accountability for the facility's alleged role in Cymbol's death. Peirce, representing the family, emphasized the need for answers regarding Presty's continued employment, despite her troubling behavior. Other Presty's attorneys, Phil de la Cunte and Jim DePasquale, emphasized that they are not involved in the civil suits, but acknowledge the possibility of their client pleading guilty to the criminal charges. A status hearing is scheduled for May, where further developments in the case may emerge. This is going to be an interesting one to watch, because this is going to involve a lot of people.
Yeah, and it sounds like her kind of method of madness was insulin, that she allegedly administered excessive amounts of insulin to 19 patients, resulting in the deaths of 17 individuals. So She found something that worked and went for it. Hardcore.
Isn't insulin kind of a hard one to track too? Like
It
if
is.
you're
And I
going to
think we
poison
came
somebody with it.
across, yeah, we came across that during the Lucy Letby trial because she was administering insulin to some of the infants. And by the time they would get around to testing, the insulin was hard to find unless you were absolutely looking for it and seeing what kind of effects it would have.
Is it because the body like just uses it up and then it's not it's not traceable like a poison or something?
Correct. Yeah, and it's a lot like I think nicotine in that regard too. If you're not specifically looking for that in some sort of a toxicology type test, I don't think you're going to find it. You may find that they've got really low blood sugar, but are you going to know exactly how much insulin was given to them? No, probably not.
Is there ever a way to track that? I mean, unless you were like, I don't even know how you do it, but like kind of doing process of elimination of here's much insulin, how much insulin we have on hand. Here's how much we believe was administered in other ways. Why was so much administered over here? Kind of working it from the back end.
Yeah, possibly if they're keeping track of what they've got in stock, that would be one way to do it, to track, wait a minute, we had X amount of units this morning and now we've only got this many. I don't know. It would be really hard.
Do they keep track of those sort of things?
They're supposed to. Now, here they've got an employee who's abusing people and they let her go back to work. I'm sensing that their ability for quality control is quite low.
Yeah, it's kind of one of those they're supposed to things, but are they is the other question.
And what they might be keeping track of are the controlled substances, but something like insulin's not controlled. I mean, it's controlled in that you need a prescription, but it's not locked up per se, like a, addictive substance would be. So it's at the ready, Who knows? Who knows what they're tracking and are they tracking? I mean,
yeah.
I'm guessing no.
Judging by this, probably not.
Yeah. And she just sounds like a sadistic bitch. I'm just going to come out and say it. I'm always shocked when we hear about these medical professionals who are at such a high level. I mean, you don't just take a 9-month course and become a nurse. I mean, it takes a lot of training. An anesthesiologist, we had some stories where somebody was being quite sadistic in that regard. Like, what is your deal? It takes you years and years to get this level of licensure, and you're just fucking it away?
Yeah. I mean, unless the goal of getting into that position is to be an angel of death, which maybe for some people it is, and they don't really care, and they're going to do what they're going to, I don't know. That's a lot of work. And a lot of times people who are going to go do those sort of things don't necessarily have the patience to go through all of that work to get to something where they could do that. But I don't know. There's just an insane amount of people out there that I think are like this. And these are just the ones that we hear about that are getting caught.
And that's the bigger point. How many, I mean, she was at 5 different facilities. At the first one that let her go, they knew something was up with her. Is there no way to maybe have some sort of reporting system? Okay, maybe know. I mean, maybe you didn't get along with people at your first job. You kind of turned into a jerk. You move on to the second place and everything's fine. Or it's not, and they let you go. But then what?
At a facility like that, though, people are dying all the time. That's the thing. I mean, so I suppose but at 17 under your, is that a ridiculous amount over several years to have 17 people die under your care when you're at a facility where people tend to die a lot?
I think it seems high. It does seem high, but if you're working at an assisted living / nursing home facility, it wouldn't be unusual. But what is unusual, and I think this is where it falls back on the staff. What is this person like when they're with the patients? If they are the absolute most wonderful human being and treating these people with respect and they happen to die because they are high risk of dying, that's what happens. But her coworkers knew some shit was up. They knew she was a problem.
I imagine there must be like some sort of average baseline for the average employee that is doing their job that has people die. Like how many in a year? Like 5, 6, whatever that number is. And then if you have one that's spiked way higher, It's like maybe that person had a bad year or that person is doing something horribly wrong. And then
look at Lucy Letby.
Exactly. Yeah. Where it just became a very unnatural amount that seemed to have happened in very unnatural ways for people that were otherwise in health that wouldn't necessarily have been in the path of, imminent death.
Well, and if you look back at Lucy, she was in the NICU. That's where the critical patients were. So was it unusual that babies were dying? No, not until the numbers got really high where they started to go, wait a minute. Yeah. This is weird. They all seem to die under her care.
Mm-hmm. Well, that's kind of seems to be the pattern too. And then it's hospital hopping almost, where it's like, okay, got enough done here. I'm going to start going to another one where I'm not raising so many red flags. And then you go and do your amount there and then jump again. It's a lot
there has to be some sort of a way of tracking these people. If it's one thing if you're not getting along with your coworkers, it's not the right environment for you. I can see how your attitude could change.
Yeah.
But if she's at multiple places and multiple managers and coworkers are like, she's abusive, there's got to be a way to stop her.
One would think, although I don't know what I have no idea how this is tracked in the medical world. If there's like a running sheet that goes with you or something of here's their history of employee, or is it just you're an employee and once you leave or you quit or you're fired, that's it. And there's really no record of it beyond that. Here's the problem in the U.S. That I know outside of medical, maybe it applies to jobs like this in medical as well, of employers today don't want to give recommendations or anything other than confirming employment.
Correct.
Just recommendations are a thing of the past because if you say something negative and it comes back to the person who's applying for the job, they can turn around and go after you or that former employer for saying something negative, which is utterly insane, but that's how the world works today. I remember when I was working for somebody more than about 10 years ago in radio, I remember my boss said that we can't do recommendations anymore. And it was just, all they could simply say is, yes, they were employed here from this date to this date.
Wow. Yeah. So really all you have to go on is the fact that, they were a crap employee, but they were employed for 17 years. So they must have been doing the job okay if you kept them there for 17 years, kind of a thing.
You got to figure it out for yourself because you can't ask the question or they don't have to give the answer if they don't want to. And it doesn't mean they're necessarily bad. Most of the places that are giving that answer are going to tell you flat out, all I can do is confirm dates. It's not a reflection on their performance, positive or negative. It's just, we have a policy of we cannot discuss anything about anyone from our best people to our worst people or why anybody was fired or why they left or anything. It's just, they were here from this state to this state to confirm basically their existence there.
Man.
So when that's the case, maybe it's far more difficult to identify people like this from hospital to hospital, unless you already have an inside person or somebody that you can talk to kind of off the record and go, hey, what is the story over here? Which I don't know if that's even legal, but people do it. But not every time do you have that insight either, or that inside person that can give you, kind of that feedback.
Oh, and it's frightening. You've got these medical professionals who are in charge of your life, literally.
Yep.
Wow.
They could have been fired from their last place because they were killing people with insulin, but maybe no charges were ever brought, and the hospital certainly doesn't want that attention on them. And if they can just kind of hope maybe this will be brushed away and go away, they're just going to keep hospital hopping until their reign of terror is finally reined in.
Want to listen ad-free? Want advance access to all of our interviews before anyone else?
Become a True Crime Today Premium Plus subscriber on Apple Podcasts.
You get every episode commercial-free.
So you can binge on true crime
until you can binge no more.
Search True Crime Today Premium Plus on Apple Podcasts now, or go to our podcast page and sign up now.
More of the Hidden Killers podcast next.